Worldwide, more than 1 million people will get colon cancer this year, and about 1/3 of them will eventually die from it. Unless something changes, 5% of all babies born today will get colon cancer in their lifetime. It's the second most common cancer in women and the third in men. So how can we prevent or discover colon cancer early enough for a cure? When I started my training, an examination of the colon required a barium enema and was often followed by advancing a rigid 1-foot-long steel tube into the patient without anesthesia, positioned over a bent table with his or her bottom high in the air. It was an uncomfortable experience for the patient and the doctor, and it missed too many cancers. But things have changed with the development of fiber optic flexible scopes. Now it's almost like cave spelunking, where after running down to the end of a long cave, one backs out slowly, searching by powerful flashlight for stalactites and stalagmites. In reality, we explore the whole 5-foot colon while the image is exploded upon a large television screen, allowing the team to find even subtle and small yet potentially dangerous lesions. Still, a vigorous and somewhat uncomfortable cleansing of the bowel is required, and then there are risks from that colonoscopy that follows. On the other hand, a gentle, comfortable anesthesia is provided during the procedure, and the risks are overwhelmed by the reward of discovering cancer early. In a review of 352 colonoscopes that I performed between 1999 and 2003, I found 164 people, or 47%, had polyps, and 8 people, or 2.3%, had cancer. Other studies have found that when a particular type of polyp, measuring greater than 0.4 of an inch, is removed, then that colonoscopy reduces cancer death risk by 40 times. Although it's important to have a colonoscopy when there are symptoms like blood in the stool or change in the bowel habits, a screening colonoscopy can discover cancers before they cause symptoms, and thus has a better chance of catching cancer early, before it spreads. I lost my father to colon cancer, and I have had 3 polyps removed from my own colon so far, so I'm sensitive to this issue. My next colonoscopy will be coming up in December. So when is yours scheduled?